Hi, good day everyone. I'm Bea Lorena Bechaida from BSN TY2-3A. In this video, we will discuss about diabetes insipidus, its definition, main type, signs and symptoms, causes, and its pathophysiology. What is diabetes insipidus? It is a rare condition that causes your body fails to properly control water balance and make a lot of urine that is insipid or colorless and odorless. What is the main problem in this disorder? It is caused by problem with a chemical called vasopressin, which is also known as antidiuretic hormone or ADH. The vasopressin is produced by the hypothalamus and stored in the pituitary gland until needed. The hypothalamus is an area of the brain that controls mood and appetite. We have two main types of diabetes insipidus: the central or cranial diabetes insipidus and nephrogenic diabetes insipidus. Cranial diabetes insipidus, this is where the body does not produce enough vasopressin to regulate urine production, so excessive amount of water are lost in the large amount of urine. Cranial diabetes insipidus is the most common type of diabetes insipidus. It can be caused by damage to the hypothalamus or pituitary gland. For example, after an infection, operation, and brain tumor or head injury. While in nephrogenic diabetes insipidus, this is where vasopressin is produced at the right level, but a variety of reasons, the kidneys do not respond to it in a normal way, or an inability to concentrate urine due to impaired renal tubule response to vasopressin, which leads to the excretion of large amount of dilute urine. It can be inherited or occur secondary to conditions that impaired renal concentrating ability. Damage to the pituitary gland or hypothalamus from surgery, tumor, head injury, or illness cause diabetes insipidus by affecting the usual production, storage, and release of antidiuretic hormone. It can also be inherited or genetic, having polycystic kidney disease, or in pregnancy. What is the signs and symptoms of diabetes insipidus? We have extreme thirst, polyuria, insipid urine, frequent urination, dry skin, constipation, weak muscles, and bedwetting. So let's talk about the pathophysiology of diabetes insipidus. It is where a person have low-level hypofunctioning or having absence of antidiuretic hormone occur, where antidiuretic hormone is responsible in stimulation of water reabsorption by stimulating insertion of water channel or aquaporins into the membrane of kidney tubules, so that renal tubules permeability to water decreases that may cause low water reabsorption in the kidney. When this occurs, a person may experience polyuria or excessive urine output, while the person experiencing thirst because of the excessive water loss. If the person did not take fluid to replace water loss, he or she may experience dehydration with a manifestation of dry skin and poor skin turgor that may lead to the nursing diagnosis of deficient fluid volume. Another one, because of polyuria, patient may have distended bladder due to the excessive amount of urine inside. And when it reaches the kidney, it may cause some problems such as hydronephrosis or a swelling of the kidney that may lead to the renal insufficiency. Also, because of excessive urine output, patient may have low urine osmolality and decreased urine-specific gravity due to urine dilution that may lead to insipid urine or the colorless and odorless urine output. Due to polyuria, patient may experience interrupted sleep at night that leads to the nursing diagnosis of disturbed sleep pattern. Due to the interrupted sleep that patient will experience lack of sleep, and in the morning, he or she will likely feel weak or tired that may lead to the nursing diagnosis of fatigue. Also, because of having frequent and excessive urine output, he or she may experience interruption in activity in daily living. To the other side, because of having low water reabsorption in the kidney, this causes to have an increased serum osmolality due to imbalances of electrolytes in the body that causes increased serum sodium or hypernatremia that may stimulate osmoreceptor to the body to feel severe thirst or what we call polydyspia. When a person has severe thirst, he or she may increase fluid intake, but most of the time, they do not know why they are so thirsty. This may lead to the nursing diagnosis of deficient knowledge related to the disease. Another one, because of severe thirst or dehydration, a person may experience tachycardia due to the low level of water in the body and blood, so that heart will pump hardly to circulate in the body that may cause the person to experience palpitation or having tachycardia. Due to this, hypotension will occur because the force of blood moving through the vein is lower, that may lead to hypovolemia or hypovolemic shock, because low blood volume causes a drop in blood pressure and a drop in amount of oxygen in the body, so that this lead to the nursing diagnosis of decreased cardiac output. And lastly, because of polydipsia, patient will have a risk of increased hypernatremia if dehydration continues. That may cause the body to feel restless and decrease reflexes and can in turn provoke seizure. I hope you guys to take this an additional knowledge when it comes to the topic and pathophysiology of diabetes insipidus. Thank you for watching!